Welcome to Tecnishe, where we treat your emergencies as emergencies. My name is Vilakshan Khanna. Next slide, please. Next slide,
My name is
please.
Maya Khanna.
So how many of you have had to wait for more than an hour in emergency rooms? I know I have, with a broken nose. In fact, research shows that the average waiting time in emergency rooms is around 5 to 6 hours. Next slide, please. This brings us to the problem. Long waiting times in emergency rooms and people going to the ER instead of using telehealth services. This leads to overcrowding in emergency rooms and increases the risk of potential disease outbreak. In addition, it impacts the nurses with their judgment in the short term, and in the long term, it takes a toll on the mental health. We have repeatedly heard that the reason behind waiting times is the lack of nurses, beds, and doctors. That is not something that we can change. That can only be changed by the healthcare system.
Next slide, please. But what we can do is divert the patient flow. As seen here, the patients that go into the ER in most volume are CTAS levels 3 to 5, many of whom can easily be redirected. Next slide, please. We want to make a mobile and web application for a virtual triage scheduling system. Next slide. This will reduce waiting times by redirecting patients to telehealth companies or by giving them the best time slots to go to the ER. Next slide, please. Next slide. Okay, so suppose we have two patients, James and Susan. On logging in, they will answer a few questions concerning their condition. They will both be assigned a triage score. If James is more critical, we will be recommended to go into the ER immediately and an ambulance will be sent. And Susan will be suggested a best time slot to go into the ER, or she will be connected with virtual telehealth companies. Her situation will be regularly monitored. Next slide, please. The outcomes that we expect are a reduction in waiting times to 40 to 60 minutes, improved patient flow and experience, and saving the healthcare industry more than $2 billion. Next slide, please. Although everybody can use the application, our main focus is on non-emergent care patients. Our other customers are telehealth companies that the patients will be redirected to. Potentially partnering with these companies can help us make a real difference in the emergency rooms. Next slide.
The telehealth sector is exploding worldwide, and geographically in North America, the potential is immense. The ER patients are the largest source of customers for the telehealth industry. We want to act as a patient magnet. We aim to redirect all non-emergent patients to these telehealth industries. Next slide, please. To make a profit, we don't want to charge our patients to use our service. That would demotivate them in time of a crisis. Right now, the most appropriate method would be through licensing fees from the telehealth services that we want to connect to our application. Next slide, please.
After partnering with Bounce Health Innovation in July, we pivoted our idea and focused on triage and scheduling. In the past months, we have made a lot of progress and evolved greatly. This has helped us understand our market, customers, and revenue. We have had multiple interviews with future consumers, ranging from old to young, and have spoke to telehealth companies about the challenges that exist in virtual healthcare. We have developed our wireframe and are developing our prototype and algorithm. Next slide.
Next slide, please. We've had interviews with researchers from Saskatchewan to Paris that gave us insight on the algorithm development, patient flow, and how to reduce waiting times. Seeking feedback has helped us pivot from triage to also incorporating telehealth companies. The more we look into this, the more we understand the gravity of this problem and the dire need for change. Next slide, please. In the future, we want to work closely with nurses and doctors to make the most efficient virtual triage algorithm, which will help us build an effective AI system for the second part of the application, which includes assigning the most effective time slots to patients. Which brings us to our ask. We'll be grateful to connect with any medical professionals and telehealth companies that may be interested. Thank you for listening, and we hope you all are just as excited as us about our product, as this concerns every single person in Newfoundland. Yeah. Thank you.
Thank you.